Hiya, my name's Bob. I'm an associate clinical educator. I'm a role player and a simulated patient, working with health professionals up and down the country in a number of hospitals and institutions. Today I'm going to talk about top tips for passing the OSCE. Now, it's true to say that there are many channels on YouTube talking about how to pass the OSCEs, but I've yet to see one that talks about the psychological aspects, the mind state that you need to be in before an OSCE. Top tip is always number one, read the question. This is vitally important, and I've seen so many students trip over because they haven't read the question. I remember just a couple of years ago undergoing a cardiovascular exam from someone who should have been doing a respiratory exam. Needless to say, the respiratory exam would have been marvellous if it had been done in the same manner as the cardiovascular exam. However, it wasn't. It wasn't the exam they wanted, so they failed that station. I realised that the student halfway through had made the same mistake, but she didn't want to change tack, so she carried on regardless. If only she'd stopped, recalibrated and got on with it, things would have been fine. However, she failed that station, no doubt taking with her the angst from that station onto the next station. That's something I'm going to talk about in future episodes. But today we're going to talk about reading the question and what we do just prior to that point. Okay, this is vital. When we move from station to station, we take with us ideas, expectations and assumptions about what happened on the last station or what is about to happen in this station. Logically, you don't know what's going to happen on this station. You know what the question is, you've prepared your notes and you're ready to go in. What state are you in prior to that? I can guarantee most students, when they talk to me about this, they'll say the nerves can overcome them, they lose focus, some of them get tunnel vision, all of the standard fight or flight symptoms of a human under pressure. So how do we deal with that? One of the best ways is to recognise the state you're in and notice where the feeling is in the body. We all experience fear in different ways. So for example, if I'm having doubts or fears prior to, say, an examination of some kind, okay, the feeling tends to be in my chest and it rotates and moves in my chest in this fashion. I know through practice that if I push the feeling down into my legs, I feel strong, I feel steady and I'm ready to go. And usually when this happens, I exude confidence as I walk in the room. I'm an actor originally by training, and this is something I would do prior to going on stage. I need to get myself in the right state to perform adequately, and it's no different for an OSCE. So this is what I want you to do, guys. Remember a time when you were totally confident and go back to that time, remembering what you saw in your head, the sounds that may have been going on and the feelings you had in your body. Now this is the key thing, the feeling. Notice where that feeling is. Now this can be confidence about anything at all. It could be if you're a confident driver, remember the time when you were driving? Go back to that time in your mind's eye. See yourself either through your eyes or see yourself in the third person driving and notice how that makes you feel. Identify where the feeling is. This is absolutely crucial. Now that you've identified where the feeling is, what it's doing, i.e. does it move, does it spin, does it pulse, is it warm, is it light, is it heavy, is it light? Just go with that. Keep that. Hold that in your head for the moment. Now, let's put you back into a position where you've just done an OSCE. And I'm sure those that have done OSCEs time and time again can remember that time, that fear that impacted them. Notice where that feeling is now. So go back to a time when you were lacking confidence, when you were slightly afraid. Let's do an OSCE, that's always a good one. Remembering the situation. If you need to close your eyes when you're doing this, it usually helps you to visualize it better. So go back to that time, seeing what you saw, hearing what you heard, but feeling, notice feeling what you felt at that time. Notice where the feeling is. And all we've got to do, the trick is move the feeling from a point of fear and lack of confidence to that area in the body where you experienced confidence. Now, I know this is a quick fix and a simple trick, but 80% of the people who do this technique find that it's very, very effective. There are other methods as well, and we're going to discuss those over the next few tips. So top tip number 1, what do we do before we read that question? Recognize your mental state prior to reading the question. Deal with that, read the question, focus on what you're doing, and take that state into the room with you. People who do this, and I've been on the other side of that door, people who've done this, the students have walked in the room, I've seen they've done the exercise, and they exude confidence. Their physiology changes, their breathing is different. The manner in which they handle me, the patient, is very different. The student leaves the room, and the examiner always inevitably says to me, wow, I like that person. They had a certain confidence about them. Now, sometimes some of the examination process might have been slightly wrong, or they've missed something. It may have been something they've missed in the history, or something they've missed actually on the physical exam. Nevertheless, the overall impression that the examiner gets is that this person is safe, is confident, and is in control. And if one thing we need with medical professionals is to be in control, builds a lot of rapport. Thanks for watching. Look out for top tip 2.